And let me just briefly explain that these are the most sophisticated decompression systems in the world. These machines are sold around the world. They're in Asia, the Middle East, Europe, Greece, Turkey, France, Germany, Spain, Canada, and they're gaining in popularity because of their functionality. But these machines are very expensive to manufacture. They're workhorses. They will last you a lifetime, which is why they're not inexpensive to purchase. But what you will pay when you purchase this machine will be just a small ticket compared to the income you will generate. Now, once you go through your exam process with the patient and they come back for a report of findings, that's where you go over what they have and how you're going to treat them and what is it going to cost the patient. Now, if you're part of the antalgic tract team, you're going to get a booklet like this customized to your office. In this booklet, it explains the few items of why the patient feels what they feel. We would go over in much more detail of this booklet, but it's proprietary and it's something that we only want our antalgic tract doctors to have. But it talks about how misalignments can create nerve pressure. It shows some examples of spinal degeneration. It shows the differences between the old decompression versus the new. It shows a little bit about chiropractic care if you do that in your office. It shows a little bit about acupuncture if you do that. It shows about laser if you do that. It talks about injection therapy if you do that. Each booklet is customized to the services in your office. It talks about the general modalities that we have here. Some of you have them, some of you don't. Doesn't really matter. And then we have a worksheet. And in this worksheet, it lists a series of spinal conditions that are treatable, improvable, and maybe correctable. And then it has a fourth column, which is we call complicators. Now the complicators list a whole bunch of conditions that you've already seen in your office, but these complicators can sometimes affect the progress of the correctable symptoms. For instance, if you have sciatica on your correctable condition, if they have a disc herniation, that would be a complicator to the sciatica. It may or may not affect the recovery. If you're using the decompression, you have the best possible chance of correcting or improving that herniation without surgery. Most patients don't want to start with the surgery. So after we go through this page, now they have a pretty good understanding of what they have and the complicators to their condition. Then we go through what we call a healing timeline. How many weeks of therapy does a patient need? It starts with 1 and goes to 16 plus. Because certain conditions like misalignments can sometimes be improved in 2 to 3 weeks. Ankylosing disease, that's kind of a tough one where we've got a minimum of 12 weeks of therapy. Degenerative disc changes can go 8 weeks or longer, disc bulges 6 to 10 weeks, disc herniation 8 weeks or more. And a lot of these conditions are at 8 weeks or more, and that's because most of these conditions have cartilage as the base or a component of the problem. So if it's the disc, you know the cartilage. If it's the facet, it's cartilage lined. If it's the bone itself, it's encased in cartilage. So once a patient has cartilage damage, we know that cartilage needs 8 to 12 weeks of therapy. So it makes really a lot of sense if somebody's having therapy, start them at an 8-week minimum, reassess them, and then you'll be able to make your future recommendations if they need them. On the last page, we show the 2 types of programs of care. We have our select care, which is the kind of therapy on some level that you're already doing. And then we have the decompression program, which is typically more time consuming, it's more expensive, but it does include all the select care modalities that you're already using. And so I will choose between the two. Some patients, I can let them choose. I know the decompression is a faster way to the finish line for them, but not everyone can afford it. But once you've gone through this process of clarifying their condition, clarifying the complicators of their condition, and explaining the timeline, and then you get to your treatment recommendation, you're pretty much 90% there for the patient to understand what you've said and want to go along with your recommendation. you've explained it thoroughly, you've shown them, you've gone over their MRI if they had it, their x-ray, you've done an exam that maybe their reflexes are either absent or diminished. That's typically disc involved, sometimes facet involved. And now you give them the choice of the care. Most of our patients are going through the decompression program. We put in the amount of time they'll need, we put in the weeks that they need and the treatment schedule, and then based on after the re-exam, additional care may be determined at that time. So if you don't have a fairly standard report of findings protocol, and you're not covering these bases, you're not signing up even your regular patients because it's unmotivating. But when you give the patient the reason to have the care, and they understand it, and every patient understands it, you're going to get your patients to commit to care. And so the only last step you have to do is have one of your assistants come in and go over their insurance. What is their insurance going to pay, if anything? And whatever it does pay, you're only going to charge the patient the balance. And that is the secret ingredient to a successful decompression clinic. I'm Dr. David Bass. I look forward to working with you and training you one-on-one. Thank you.